Welcome, welcome. This is the Coronavirus Central Florida podcast, and I'm Maria.
And I'm Melissa. Thank you for joining us. It is May 2nd, 2020, and we have some updated numbers for you here in Florida. Our confirmed cases are now 35,463, and unfortunately, we have 1,364 deaths. Now, the nice thing is the curve is slowly starting to flatten. You know, we've seen those numbers were like going crazy there for a while, but now those numbers are slowly starting to flatten out, which is what we wanted to see, right?
Absolutely. I think that we should all be very proud because most of us have been social distancing and quarantining and, doing the right thing, wearing masks. And because we have mitigated those very scary numbers we were seeing in the beginning to these more manageable numbers, we will be starting the grand opening of Florida Phase 1 Monday. So yay us. So
Right. Yeah. And I did go to the beach today, but I don't hang out at the beach. Usually I do with my kids. We will go out to the beach, but I've not been doing that since COVID. Today I did go out. I went out by myself and I don't put my kids at risk, and I don't hang out at the beach. I literally go straight into the water, and I don't get around the other surfers. I have my own space, and it's my happy place out there anyway. I'm fine to be out there and just enjoy the peace and quiet. So I don't need to have somebody out there with me. But I was blown away. There were so many people out there today, and there were people camped out at the beaches, set up, having a hard time finding a parking spot. It was amazing how many people were there. But what was more amazing is I think I only seen maybe 2 people that were even near the beach wearing a mask. That's scary to me.
that is very scary because once we start opening up the state, we don't want to see another peak, another rise in the numbers. We want to gradually open up everything so that it's a smooth transition. We don't want these numbers to go up and spike up again. So it's definitely worrisome that you didn't see most people wearing masks. I went out today to Target too, and most people were not wearing masks.
I think people have this, oh, well, we're back open and the numbers were never that bad, so I don't need to be careful. No, the numbers didn't get as crazy as they were supposed to get because everybody stayed home. And there are people that are still very, very, very cautious and going to stay home. But for those who are eager to get out and are going to get out, we have to be wise about this. If you need to get out and you want to get out, please wear a mask and please be careful, because you're going to make other people sick if you have it and you won't even know that you have COVID. So that risk is still very much there. So we have to be smart about this.
Yeah, absolutely. Well, let's talk a little bit about what the reopening includes, what it entails. Restaurants, for example, will be allowed to have 25% capacity indoors. Tables do have to be 6 feet apart, and they will be able to have outdoor tables as well, as long as the tables are 6 feet apart. No limit there. But I do know that several restaurants locally are choosing not to open because of the risk to their employees and to their customers.
Yeah, and I don't blame them for that, because is it worth it? And I'm sorry, I'm not sure that it's worth it this early. I kind of feel like it's early. That's just my opinion, but I'm hoping that they'll be careful and watch the numbers closely. And the thing is, everybody's so eager to get back to normal that we're never going to make it to phase 3 if people aren't smart about this. So you want to get back to normal, be smart about phase 1, and please be protecting yourself and others by wearing a mask or some type of face covering.
Bottom line is, if you're going to be a customer, please be patient at the restaurant, because they will probably have long lines of folks who, are just wanting to go and visit their favorite restaurants and support them. So be patient. Also, servers are only going to be working at 25% capacity. So that means 25% of their paychecks. The fact that they will be working at all means they can no longer collect unemployment, although a lot of them haven't even started getting unemployment, unfortunately. But so now servers will be working at 25% capacity. So when you tip your servers, tip very generously.
Yeah, please. Yeah, because that's their livelihood. They rely on that. And if you normally would have 10 tables and now you're stuck with 2 or 3, I mean, that really hurts. That really hurts the wallet.
Absolutely.
I want to kind of go over, if you don't mind, some of the symptoms again, because as we get back into this and people get back out there, just be mindful of what the symptoms of COVID-19 are. And they're frequently changing. And because this is such a tricky little evil devil, this virus is so mean. And some people never get sick. They don't know, or their symptoms are so mild that they don't realize they were ever sick in the beginning, or in the first place, rather. So if you have a cough, shortness of breath really concerns me. Take it seriously, and please be seen by a professional. Any fevers, chills, muscle pain, headaches, sore throats, new or loss of taste and smell, and another thing is diarrhea. Have you heard any other symptoms?
I know that blood clotting has been an
Yeah.
issue, strokes, amputations. Like Melissa said, this is a virus that we don't fully comprehend yet. There could be other symptoms that pop up in the future. So I think that it's one of the main reasons we should all err on the side of caution and, continue being socially responsible by maintaining distance and all wearing masks, of course.
Right, definitely. Another part of phase 1 is that they're going to let the retail stores open at 25% capacity as well. So if you really need that new outfit, they're going to let people in, but just a limited amount of people. And again, I think they're held responsible with that whole fine, the 500 and the second-degree misdemeanor. So just be mindful of that as you're eager to get back into these places, that they're held to a certain standard or they get fined for that. So just be patient.
Yeah, and not all businesses will be opening. Gyms, fitness centers, beauty salons, barber shops, they're all staying closed, as well as vacation rentals.
Okay, wonderful. Elective procedures are approved now. I guess they were announcing that that's going to be moving forward. And I mean, I do know that, yes, they're going to let some elective procedures move forward. But kind of like the restaurants and the retail stores, they can't just go back to norm and have all of those patients sitting out in the waiting room. So I think just be patient. If you have been scheduled for an elective procedure, to get back on the books, they're looking at numbers and safety with the staff and the patients as well. So we'll see how that goes. I'm kind of curious to see how that trend is with the different facilities and how many patients get their elective procedures.
We also have to keep in mind that all of our medical providers are always putting themselves at risk, and they're also under a lot of stress. So as you start to visit your doctor again and your clinicians, just be extra nice to them, be extra patient with them, because we don't understand the amount of stress, that they are under.
Correct. And I was reading about a doctor in New York that had committed suicide because, I mean, she'd had COVID, she had worked in the ED, she'd gotten over it, and I mean, she just couldn't handle it anymore, and she had committed suicide. So check with your loved ones, especially those in the healthcare field, and make sure everybody's doing okay, depending on, of course, where they're working at. But not just your healthcare professionals, I think really just people in general. I think I'm going to throw it out that way because, people have been stuck in their homes and they're lonely and they miss that connection with the people that they love. So reach out to people and make sure that they're doing okay and that they have what they need. I was talking with a patient the other day, and literally what could have been, or probably should have been, a 3-minute conversation ended up being like literally a 16-minute conversation. He was lonely and he was such a sweetheart. A lot of people just don't have others to talk with. So if you know a neighbor or something from a good distance, be mindful, of course, of the distance and be careful, but communicate with these people, reach out. Some of these people are very lonely. So make sure people are doing well. So mental health is very important.
It is. It is. So, just pick up the phone or get on Zoom or whatever kind of communication device you want to pick and ask them if they have a mask. Ask them if they're ready, as phase one is starting Monday, if they're ready and protected to head out there on Monday, possibly.
Yes. And in saying that about the whole mask, people were like, why do I have to wear a mask? I'm not sick, and that's not going to protect me from getting sick. If everybody wears a mask, we're going to help decrease these numbers as everybody gets back out into their normal routine. Because if I'm wearing a mask and you're wearing a mask, if we cough, there's multiple layers of protection there. However, if no one's wearing anything, there's no protection there. So think that through a little bit. It's very important to think that through. And if one person's wearing a mask, okay, fine, maybe you're kind of helping protect them, but be considerate and help the other person, in case you're sick, from getting it as well. I mean, we have to be thoughtful of each other during this, phasing in process, because I have a bad feeling about this, and I'm fearful that we're going to have a spike in our numbers because people are so excited and eager to get back into their normal routine.
Absolutely. And, I do want to say that masks, you can make them yourself at home. We girls here at the Coronavirus Central Florida podcast have also learned to make them as well. And we have lots of styles, lots of different patterns and fabrics. And we're donating a portion of all proceeds to various different nonprofits. This week, we are working with the Second Harvest Food Bank, and food pantries right now are incredibly in high demand. There's so many people out there that need food and the assistance. So, even if you don't support them through us and our beautiful masks, just donate money directly to any food pantry that you want. And as far as masks, get them, make them. Doesn't matter how you get them or if it's a scarf, but protect yourself and your loved ones.
Yes, please. And I'm huge about the food pantries because they do such good work, and what they do, it's making a huge impact in the community right now. But since they rely on the big box stores, they don't get the donations that they're usually getting. And so they don't have that resource to give to the people who actually need the food. So it's frustrating. So we have to step up and help them. It's very important.
Of helping food banks, I do want to mention my local hero of the week. His name is Soo Kim. He's the owner of Oshio Korean Barbecue on International Drive. And he actually donated certain proceeds of his sales today to the Second Harvest Food Bank through us. So that was amazing. Each dollar that they receive becomes 4 separate meals. So that's a lot of meals that he helped secure for people today. So thank you, Soo Kim from Oshio Korean Barbecue.
Yes, thank you so much. We really appreciate you stepping up and helping the Second Harvest Food Bank. And then you're making a huge impact in a lot of people's lives. So thank you for that too. So we got to work together. We really do. As a community, we have to work together to accomplish these goals and do it safely, and protect each other. So,
but that's it, everybody.
Yeah.
Thank you so much for joining us. I know that we have some amazingly wonderful audience members out there. So thank you to everybody listening, and we will catch you next time. This is Maria.
And this is Melissa. Thank you for joining Coronavirus Central Florida podcast.
All right. I think it was like 17 minutes or 18 minutes or something.
Okay.
Could you hear the animal in my background?
Oh, yeah.
Oh, my God.
Could you hear Hunter being like, Mom?
No.
Mom.
It's going to work because this animal is so loud.
You looked over like, I'm about to shoot you. Yeah. So I was like, is she gonna, are we gonna keep going? I don't know.
It's gonna work. We'll see. I'll listen to it.
Okay, let's listen to it.
Yeah. Well, let's want to meet up in like 30 minutes or so?
Yeah, let's listen to it and we'll go.
Okay.
All right, cool beans.
To us.
Bye. Bye.